joined by Republican Senator and Dr. John Barrasso of Wyoming and Democratic Congressman Chris Van Hollen of Maryland. Thank you both for being here, especially on Father's Day. I want to put up on our screen for our viewers what is currently in effect in health care. Children up to the age of 26 may stay on their parents' insurance. Children with pre-existing conditions and some adults have to have coverage. It bans insurance companies from dropping sick people from their rolls. It eliminates lifetime limits on coverage for the critically ill, and it has drug rebates in it. What happens to those particular, very popular elements if the Supreme Court should say you can't have mandates, you can't force people to buy health insurance? What happens?
Well, let's just take, for example, the current prohibition on denying kids who have pre-existing conditions like asthma or diabetes health care. If the Supreme Court were to knock down the individual mandate, that whole piece is in jeopardy, just like some of these other pieces. Now, we don't know exactly what the scope of the Supreme Court decision will be, or of course what it will be, but the reality is those very important protections are at risk if the Supreme Court knocks it down. And of course, the irony is that people like Mitt Romney knew that, which is why Romney Care in Massachusetts requires everybody be in the pool, because then you pool your risks and then you don't have discrimination against people with pre-existing conditions, whether they're kids or adults with cancer or other diseases. That's the whole idea of getting everybody into the pool.
Well, also the idea is it's hard to afford to have these sorts of provisions if you don't have healthy people in the pool. If all you're insuring is sick people, you can't afford to continually not have lifetime caps, that kind of thing. Senator, the question here is, certainly we can say that the Obama administration front-loaded the great things about this, at least as far as patients are concerned. What do Republicans propose to do if the mandate is dropped and insurance companies say, sure, we'll keep it, but it's going to cost you double or triple, or what happens?
Well, first of all, Candy, I believe that this is unconstitutional. I believe there's going to be a stinging rebuke of this president's centerpiece legislation when the Supreme Court rules later this month, and they should rule that this is unconstitutional. If not, the Republicans want to repeal everything that is left standing. But you raised the interesting point, because several times you said affordable. The whole goal of health care reform was to get patients to get the care that they need from a doctor they choose at lower cost. This health care law did nothing to deal with the fundamental problem, which is the cost of care.
Sure, but now we have people that are getting benefits that I think you would sign on to, that you don't throw sick people off health insurance, that even if you have a pre-existing condition, you should be provided some sort of health insurance. So we have these sets of rules already in place, and the Supreme Court decision, if it throws out the mandate, jeopardizes those popular provisions. Doesn't it roll back onto Republicans who have fought so hard to get this thrown out?
Well, the Supreme Court may rule that just the mandate falls, or the Supreme Court may rule that the whole health care law falls.
And then what? Then what have you got?
You are not going to see, coming from Republicans, a 2,700-page bill that, as James Madison said, you shouldn't. Well, you'll see a step-by-step, common-sense solutions, but you're not going to see a law so voluminous that it cannot be read, so incoherent that it cannot be understood, and you will see Republicans coming out and say, let people buy insurance across state lines, have people owe their own.
Because we're throwing out something that exists for
that I believe is unconstitutional.
Okay.
That is going to break the bank of the United States, that continues to be very unpopular, because most people, Candy, if you go to a town hall meeting in Wyoming and you ask for a show of hands, they say under this health care law, they are paying more for their care, and there's either a lower quality or less availability of care, and people don't like that. That's why this law is so unpopular.
I want to try to get you to answer what comes afterwards, but let me let you in on this.
And that's why there's no answer here, because the Republicans said they want to repeal it, and then in the House they said they're going to get to work with their replacement. Well, we haven't seen any replacement, because while they say they want to make sure that kids are not denied care because of pre-existing conditions, the only way you do that is by getting everyone in the pool. Everybody used to understand that. With respect to the cost of health care, John knows very well that the main provisions to bring down those costs, put people in the exchanges, don't even kick in until 2014. At that time, The Congressional Budget Office, our nonpartisan referee, has said that for a given set of benefits, the cost in the individual market could go down by as much as 20%. So those parts of the law haven't even gone into effect yet.
Right, the painful parts haven't gone into effect, actually, the taxes and that kind of thing.
But the parts that also will allow millions of Americans who are uninsured or underinsured to get affordable health care.
Let me ask you, as I asked the senator, let's say this mandate goes out. What is Plan B for Democrats?
Well, the reality is this was our plan. I mean, this was the proposal we put together.
But you don't have a contingency plan?
Of course, the irony is Republicans were for this plan before they were against this plan, before President Obama was for this plan. That's why it was modeled after Mitt Romney. But no, Candy, look, the answer is that we put this plan in place. It makes sure that kids who have pre-existing conditions are not denied care. It allows kids up to the age of 26 to be on their parents' insurance plan. If they strike that down, there is no other easy answer, which is why Republicans from Newt Gingrich to Mitt Romney were in favor of this approach. This was their alternative to Medicare for all. This was the Republican idea.
What I'm hearing from the two of you in sort of response to direct questions is neither the Democrats nor the Republicans have a contingency plan for if the Supreme Court strikes down really what's the funding part of this.
Well, there's a step-by-step approach. Let people buy insurance across state lines, deal with junk lawsuits that drive up the cost of care because of all the unnecessary testing that is being done. I mean, that's the way you do that.
But when do you do that? Are you ready for it? You throw it on the floor?
Whatever the Supreme Court does, the court of public opinion is going to be right there the next day. This will be part of the campaign debates. Going into
the election, though.
Going into this will be a big part of it. You continue to use, and Chris talks about Medicare for all. No, it's Medicaid for all, which is the program that right now half of the doctors in the country won't see people on Medicaid because the reimbursement is so low. But that's the answer of the health care law. Throw 17 million more people on Medicaid, which is why 26 states have sued the federal government and say, don't make us do this.
Candy.
We can't afford it. It takes money away from education and a lot of things.
In the minute I have left, I need to know if there's any thought inside the Democratic Party of saying, whoa, we've got to figure out a way to save at least these benefits that are already in existence. Have you talked to the White House? Is there a plan B?
We don't know what the Supreme Court is going to do.
No, I know.
This was our plan, Candy.
Right.
The Republicans have been against it. They've said if the court strikes down even a part of it, they want to repeal the remainder. The answer to your question about what the Republicans would propose was what we saw between 2000 and 2006. They did nothing. Premiums from the major insurance companies doubled. It was the status quo. It was unacceptable, and the American people rejected it. They want to go back to the status quo. We've got our plan.
The president promised if you pass this, health care insurance rates would drop $2,500 per family. Families have seen the rates go up higher than that.
But in fairness, it hasn't all kicked in. But I have to call a timeout here simply because I want you to come back because this argument doesn't go away. Senator Barrasso, Congressman Van Hollen, thank you so much for joining us this morning. We will see you after the Supreme Court rules.
Thanks.